It is Mental Health Awareness Month, and the Big Ten Conference sending out an important message in conjunction with that, reminding people to prioritize mental health and to seek professional help when it is needed. And Dr. Peter Economou provides just that kind of help at Rutgers. He is the Director of Behavioral Health and Sports Psychology there, and he joins us now for our big interview. Dr. Economou, really appreciate you taking the time to talk about this. I know that every school is different, but just give us a sense of the mental health support structure for student athletes at Rutgers.
Thanks, Dave, and I'm happy to be here. The Big Ten has certainly taken a lot of initiative to ensure that our student athletes are getting the best care. At Rutgers, just one of the teams in the Big Ten, we have a comprehensive and interdisciplinary team. We are providing support for our student athletes around individual mental health, sports psychology and performance, learning issues and challenges, substance use, really the gamut of what is behavioral health. We're calling it mental health, but we know that mental health is physical health, and more globally, it's behavioral health. And there's a lot of what we do is encompassed in that.
In what ways is this baked into the system? Like, help people understand from a student athlete's perspective, how much of this is you providing programs for them, educational? How much of this is them seeking you out? Like, what's kind of the balancing act of how you provide these services to student athletes?
Great question. It's embedded in the culture, and that's something that 15, 20 years ago when I started in collegiate athletics, focused on. Historically, we were like in this private office down the hall that no one wanted to see, and it was dark, if you will, like from the movies. Now it's integrated where we're at practice, we're at games, we're at meals, really understanding that we're just another person on the team. In order to perform at our highest level, it requires all types of coaches and providers. We're just another one of those providers. And so it's something that we do once they get on campus. We make sure we meet with everybody. So for their pre-participation screens, and then also we're meeting with every team at least once or twice a year to ensure that they recognize that we're there. And so lastly, what I'll say is I like to approach this proactively, not reactively. I think that it's important that we have these systems in place, we utilize them, but we don't wait for something until it's too late.
To what extent do you think the perceptions have changed over the years? I mean, you talk about years ago being down at the end of a long hallway, literally and metaphorically. How have you seen that change through the years?
Literally and metaphorically. It's changed in the way that now we're almost having to kick people out of the office, if you will. So as a board certified cognitive behavioral therapist, my approach is understanding that we're treating symptoms and working on a treatment plan to get towards the end of treatment. So at my first session, I'm saying to student athletes, my job is to not have a job. And so the goal there is to make sure that they are, getting out. So the stigma has really decreased. I mean, of course, it's still there, and certainly for different cultures, racial, ethnic, religious identities, there's going to be those kind of diverse factors will play into how approachable one might feel. But one thing that we've done at Rutgers is really commit to that by really having one of the largest and diverse teams in the country.
I want to dig into it a little bit and just give people a sense of what you're dealing with student athletes. I know there are a myriad of different issues that people might deal with, but just kind of maybe the most common issues that you might talk to with student athletes and the kind of services that you and your team provide?
I'm going to say that they're not that much different from the general population, other than our student athletes have demands that the general population does not have. The general population is not, exercising or training 20, 40 hours a week. They're not, watching their diet and sacrificing in all the kind of ways that you do to perform at that highest level. So, but typical things would be kind of relationships, identity things, because that is common in this age group. The other thing to be mindful of is that developmentally, this is 18 to 24, and there's a lot happening both in the brain, hormonally, and so developmentally, we think about those are the kind of common things that would come up. Relative to sports, though, you'll see things like, added stress and pressure. And I think certainly one thing I'd be remiss not to mention, just the impact that technology has had on this. So I think we're looking at both social media's impact on health and well-being, and then other sort of policies and that are occurring. I mean, the landscape in intercollegiate athletics is evolving in front of our eyes, and name, image, and likeness, and all these other things, they're impacting. Not to say negative or positively. We're trying to understand that. We're just gathering data on that now. But it's something that we have to be mindful of. And so that's going to also be something that we would commonly see.
That is one thing that I wanted to ask you about. You were talking about social media. And to me, this is where it's different from the typical population, right? Because you are dealing with young people who are public figures, especially in the highest profile sports. And people might be gambling on games that involve them. I mean, there's all kinds of stuff going on here. And I think one of the byproducts of that is when you are kind of public facing, that you might take the brunt of social media more than other people would. Kind of how have you helped student athletes navigate that and navigate the public facing part of it?
Well, I joke and say in my clinical practice, I work with professional athletes as well. That's been my whole career. That's where I started. And I joke and say I got a PhD just to get the professional athletes to remove social media from their phones. It's really tremendous how much of an impact that can have on one's health and well-being. So just utilizing boundaries around social media. Again, as a mindfulness practitioner and someone who finds the middle path in all things, it's not good or bad. I mean, I'm not going to throw any of this stuff under the bus. I'm going to simply say when we use it, we have to ensure that we're still using it and that it's not using us, because that's one of the things that we start to see. And you also mentioned gambling. I mean, sports wagering has grown. I think it's like 2/3 over the last 24 months with the it's been legalized across many different states and federally. So those impacts are also absolutely going to have some significant effects on our student athletes.
I want to ask you as well about concussions. I know there's a lot of concern about concussions, particularly obviously in the contact sports and the impact they have on developing brains of young people. To what extent have you dealt with those issues?
Yeah, greatly. I serve as a faculty as well. So I'm, in addition to serving the athletics of Rutgers at the Big Ten Conference, I'm also a tenured professor. And so we do a lot of research around that. And so it's one of the areas of my research. And so and also the Big Ten, I was lucky enough to be peripherally involved with the Big Ten Ivy League concussion study, one of the largest of its kind to understand sport-related concussion. And so we are trying to, one of the things I say, like in the classroom, is we've been doing open heart surgery for over 100 years, and we've only just begun to understand the brain in the last probably 15 or so. You know, if you think about an fMRI machine, they're large and, not as accurate as they will be probably in the future. So I say all that to say concussion is a thing. It's also not a thing. I think sometimes we have to understand what we're diagnosing. There's a lot of data out there about the impact of psychological or other mental health factors that contribute to concussive-like symptoms. And so that's really the art of what we do. Anyone licensed, behavioral health provider is going, I like to say we are both science and an art. The science is driving some of the evidence-based practice, which is really cool, but the art is also understanding how all this stuff comes together. And our goal is to try and kind of see through the weeds to help the person get to that highest level.
A couple more questions for you before we let you go. I noted that you are a former student athlete yourself. In fact, you're in the Seton Hall Sports Hall of Fame. As a swimmer, how much do you rely on the experiences that you had competing as you deal with young people today?
Yeah, I appreciate that shout out. It's not much. It's something that, what we learn is that in the work that I do, I don't necessarily bring myself into it. It's not about me. It's about the person I'm sitting with. And so I think I can talk the talk maybe a little more easily than perhaps some others. But that being said, it's about, multiculturally competent providers, just trying to build rapport, build connection, and understand that, we're all more alike than different. And so trying to kind of recognize that suffering is universal and we can help people get, past the suffering. And, while those are nice accolades, and certainly some people like to hear that, it's Olympic sports. We are in a different aspect of it's not generating revenue, and those are things that are okay. So I think it's also, I can connect with some of the Olympic sports to say like, hey, this is cool. Like, use the resources around you. That's what's cool about the Big Ten. With the Academic Alliance, it's not just performance that a lot of our viewers will watch. There's a lot more things that go in: research, academics. Those are things that are really important, especially for those in Olympic sports, because there's very few Michael Phelps in my example. There's very few of them that can go on beyond their collegiate career.
Last question for you. What's the best part of working with student athletes?
Well, all of it, I'll say. I think it's really exciting. One of the things I will often say is that, I work with CEOs, professional athletes, do a lot of executive coaching. At that time, it's never too late. You actually can teach an old dog new tricks. But 18, 22, 24-year-olds, this is a really cool time. I think it's really important. That's NCAA's mission about trying to develop both, the person and the athlete. And to be able to be a co-pilot along to develop somebody is such an honor and a privilege. And it's a really exciting thing. And we want to get better, so the motivation to kind of manage whatever it is that we're dealing with certainly makes my job a lot easier. It's not all great. Certainly there's a lot of challenges that a lot of our athletes will face, just for various reasons. But generally speaking, as a student athlete, we are committed to getting better. So it makes my job a bit easier.
Dr. Peter Economou, really appreciate you joining us here. Really important stuff, and appreciate you helping us shed some light on it.
Thanks, Dave. Thanks for having me.